in also evaluating this chronic pain panel, many of the patients may be on different medications. They may be on several different types of pain medications. And so the other thing that is excellent that Dr. John can assist with here is your detoxification pathways, and being able to look at these pathways and come in here and assist with detoxification needs is huge, because if we can identify needs where there are genetic weaknesses in, for instance, detoxing in different pathways, and this is a great example here, this AHCY homozygous, which just means there's two mutations on as far as this gene is concerned, and can overall affect there's a pathway called the methionine pathway, and a lot of times this polymorphism will lead to low homocysteine. Well, we know if there's low homocysteine, then that can affect the overall production of glutathione. Yes. Which we know helps us detox at a cellular level. So that's a great thing that you can come in there and suggest things that can assist with the detoxification, will also help reduce inflammation as well.
Yeah, it's because your body is connected. The first thing that you need to take a look at is the information, is how well your body is turning on the information and how did you turn off the information. If you have a genetic makeup that has any issue with controlling inflammations, then of course you're not going to be healing fast the way your body can. Right. So that's why we have ways to control and support the inflammation so the body can heal through genetic testing. Right. And another thing is that detoxification, right? If your body cannot detox, if you cannot get rid of the toxin in your system, still stay in your body, of course you have more inflammation. Mm-hmm. Of course, you're going to not heal the way it should be. And then also, the good thing is that, like I said to my patient, is that when I do a genetic test on the patient, not only that I will be able to help the patients, but I also be able to help their families, because their families would have a similar makeup. So this is, genetic testing is such a powerful thing. So yeah. So first thing
it is, and as you know, you have already started seeing entire families, because the apple doesn't fall far from the tree, so to speak. So you see those genetic weaknesses, and then a lot of moms and dads want to know what the status is of their children. And a lot of times, especially with these types of results and being able to detox, you're taking a preventive approach with some of those children, and when they reach adulthood and maybe need some sorts of protocols and treatments that can help overcome these genetic weaknesses long before there's a buildup of toxins over time due to environmental exposures and things like that. So, a lot of, I think, of what the listening audience would definitely like to hear is that you're taking a preventive approach with the healthcare, not only just reactionary to issues and how that patient's presenting and those symptoms, but really coming in early and kind of seeing that roadmap and able to apply the appropriate treatment protocol.
Yes, this is just like life-changing science that we have here.
Right. Well, the other section that we do go over with chronic pain that I think is very interesting is the neurotransmitters here. And
that's really so important.
And we're able to identify some mutations, I think, that's really interesting on this GAD1 mutation. Yeah. And we may have talked about this last time, but when patients are what's considered GAD1 symptomatic, which when the sun goes down, we talked about that, we're supposed to convert about 40% of the glutamate to GABA to prepare the body to taking it from a more stimulated state to a calming state, which GABA is, to prepare the body for sleep and things like that. When we see two mutations or either or both of these mutated with what's called a heterozygous state or one mutation on each, we can see those patients that have symptoms of things like dysphoria, which kind of is an overall dissatisfaction of life at times, and there's varying degrees of that. And the half glass empty syndrome, where they will tend to, friends and family will say, well, why are you looking at these situations that we talk about when things come up in sort of a negative way? And it's just some of the symptoms that we see in clinic from patients, along with brain spinning, where they can't turn their brain off at night and go to sleep, high blood pressure associated with this, constipation, and their overall sensitivity to prescription drugs. They're highly sensitive and very in tune with all changes in their body, and it's a glutamate GABA imbalance. And so when it comes to pain, these patients will have, again, a lower pain threshold, and will be much more sensitive. So when, I think when you can come in here and affect that ratio and be able to drive up GABA with a special form of GABA called beta-phenyl GABA that's in one of the products that you offer, that can drastically change that ratio and really help with decreasing some of those things. And I think that's an interesting dynamic that you can do in clinic.
Yeah. So I do have many patients that would have this GAC1 genes that being positive. Mm-hmm. Just sharing some story is that they have trouble, like they can fall asleep, but they have, like when they wake up in the middle of the night, their mind is keep racing, keep thinking of things. It cannot stop. So that itself will affect their healing ability.
Right.
They of course, they're low in energy. So the body is interconnected. And then there's always like in terms of like the patterns. So Dr. Stewart was mentioning it like people from in the Europeans or in Russians, they tend to have more of these genes, right?
Right. Yeah, it's very interesting, and seeing the effects of this, which is really amazing when they have decreased symptomatic effects of this and feel happier and less anxiety. Anxiety is a big one with this, and
yes,
a lot of patients will self-medicate here just to calm themselves down. Adults will do that with alcohol and marijuana, and what I like what you do, Doc, is really kind of come in and address the underlying issue. Well, why are you self-medicating? Why are you seeking this to sort of calm your nerves, if you will, kind of effect? And that's the cool thing, is you can tell the patient, well, this is why you're feeling this way, and no, you're not crazy or whatever friends or family tell you and all this stuff. It's just an imbalance that I know you can help those patients out with. So that's really encouraging, because it can help with that chronic pain and help reduce that as well. So
that's
really awesome. Yeah.
Like I said earlier, like with with my chiropractic techniques, and then also now I have the genetic from the GX science. Now I haven't seen anyone that I cannot help with like chronic. I see patients not just like simple pain, but like chronic severe pain. Those are the people I really want to help.
Yeah, and I thought also these genes here are really cool, because you may get a patient who goes to a chronic pain clinic and is on different types of opiates, and they're saying to you, doc, I mean, I've told my other doctor that those meds don't work for me, and they may be on a pretty significant dose, and they are an ultra metabolizer of that particular drug, and we'll be able to tell here and say, yeah, you probably need higher dosages to be able to control that pain. And then what's interesting is you'll be able to offer a pharmacogenetic test, which is very reasonably priced at $225, and be able to have them download an app on their phone where they will have the actual commercial prescription names of the different drugs that are applicable for their genetics, where they're a normal metabolizer of those drugs, and those are the ones would work best with their genetics. So they don't have to guess on which pain medications that they need to take. It's right there on their app. It's updated in real time twice daily. So if another provider puts them on a different medication, they can put in the name of that drug and will tell them if it's going to interact poorly with the existing meds that they're on, and is it appropriate for their genetics. So I love that, because this is a wealth of information in addition to your other therapies that you do. Just can be able to give them that information so they have access to it. And the other gene will tell them also that we test, yeah, you may need a lower dose of opiates, and you're maybe an ultra slow metabolizer of that, so that the effects of this are much stronger for you. And so this is all just some great indicators that would indicate, yeah, maybe consider some pharmacogenetic testing and stop guessing.
Yeah, that's why the beauty of like genes and knowing exactly where the weaknesses are. So like Dr. Stewart said, is the genetic is giving you the right supplement at the right time for the right conditions.